In today's episode, we uncover a growing crisis in our healthcare system, one that's affecting patients in both rural and urban hospitals across the country. Imagine going to the hospital, trusting the diagnosis and lab results, only to be given the wrong medicine for a disease you don't even have. This alarming trend is causing widespread concern among medical professionals and local hospitals in Africa. Doctors and nurses are expressing doubt and frustration as the integrity of our healthcare system is called into question. But the impact doesn't stop there. Patients are not only facing unnecessary treatments and increased medical bills, but also psychological distress, anxiety, fear, and a loss of trust in those meant to care for them. How did we get here? What's causing these dangerous mistakes? And most importantly, what can be done to restore faith in our hospitals and protect patients from harm? Join us as we dive deep into the stories, the causes, and the solutions to this urgent problem. Stay tuned and don't forget to subscribe for more eye-opening. If you think this story sounds unbelievable, then this video is for you. Watch until the end, because what we discovered will truly shock you. Today, we're sharing 3 major cases. Real stories of people whose lives were turned upside down by the negligence, ignorance, or unprofessional conduct of doctors in some of the country's private clinics and hospitals. But let me ask you, have you ever gone to a hospital, or heard of someone who did, with symptoms that seemed like malaria or the flu, only to be told by a doctor that you have something completely different? Maybe they mention a disease with a complicated scientific name you've never heard of, leaving you confused, anxious, or even pressured to buy expensive medication you might not need. Why does this happen? Is it a genuine mistake, or is there something more troubling going on? Are patients being misled, persuaded, or even blackmailed into believing they have illnesses they don't? In this video, we'll reveal the shocking truth behind these cases, expose the tactics used, and show you how to protect yourself and your loved ones from falling victim to medical misdiagnosis and unnecessary prescriptions. Stay with us, because what you're about to see could save lives. If you've experienced something similar, share your story in the comments below. Don't forget to like, subscribe, and hit the notification bell for more eye-opening investigations. Patient Story 1, 7 years of misdiagnosis, the Nairobi HIV case. Peter visits a local hospital in Nairobi for a routine checkup. He is diagnosed as HIV positive and prescribed antiretroviral drugs, ARVs. For 7 years, Peter faithfully takes his medication, believing he is HIV positive. Over time, Peter's health declines, not just physically but emotionally and socially. He faces severe stigma from his community and workplace. The psychological burden grows, affecting his relationships and mental health. The family spends significant money on medication and related health care. Concerned by Peter's deteriorating health, his family decides to seek further treatment abroad. They travel to India, hoping for better care and answers. In India, Peter undergoes comprehensive medical tests and evaluations. The shocking result, Peter is HIV negative. He never had HIV. 7 years of unnecessary medication, stigma and psychological torture, financial strain from years of treatment and the cost of traveling abroad. Relief and anger, relief at the truth, but anger at the years lost and the suffering endured. Highlight the importance of accurate diagnosis and the devastating effects of, emphasize the need for second opinions and patient advocacy. Patient Story 2, misdiagnosed brain tumor, the Coastal Province case. Ali is admitted to the hospital after experiencing severe symptoms. Doctors diagnose him with a brain tumor and warn that it could cause paralysis. He is rushed to the intensive care unit, ICU, and his family is left in shock and fear. Unsure about the diagnosis, Ali's family reaches out to a doctor in Australia for a second opinion. The Australian doctor recommends bringing in a special diagnostic machine from South Africa, equipped with advanced AI technology. The machine is brought to the hospital and used to re-examine Ali. The new diagnosis reveals that Ali does not have a brain tumor, but rather a blood clot. The machine identifies the exact problem and delivers the correct medication. Ali's condition improves rapidly. He recovers within a few hours. He is discharged from the hospital, healthy and relieved. The initial misdiagnosis could have led to unnecessary, risky treatments and long-term consequences. The correct diagnosis and treatment, enabled by advanced technology and a second opinion, saved Ali's life and prevented further suffering. Patient Story 3, throat cancer, misdiagnosis, the quick recovery abroad. Samuel visits a hospital after experiencing throat pain and discomfort. Doctors diagnose him with throat cancer, delivering devastating news. He is advised to begin cancer treatment immediately. Doubtful and seeking hope, Samuel decides to travel abroad for a second opinion. At the foreign hospital, he undergoes thorough medical tests. The new doctors find that Samuel does not have cancer at all. Instead, he is suffering from a simple throat infection. Samuel is prescribed a course of tablets to treat the infection. He recovers quickly, avoiding unnecessary cancer treatments and the trauma of a false diagnosis. Samuel is relieved but also frustrated by the misdiagnosis. The story highlights the importance of second opinions and accurate testing. It also underscores the emotional and financial toll of medical errors. Cases of patients being given the wrong medicine or receiving treatment for whether it's due to inaccurate lab results, ignorance, or even the intention to make money, these incidents are raising serious questions among the public. Are we witnessing laxity, a lack of professionalism, or simply a lack of commitment and seriousness from our hospitals and medical practitioners? Imagine the extra costs you might face or the difficult situations you could be put in simply because you were given medication for a disease you don't even have. Think about the psychological impact. Being told you have a life-changing illness, only to find out later it was never true. These are just a few of the serious cases and scenarios that have come to light. Many more remain hidden, affecting countless lives. That's why, if you or someone you love is sick, especially with a chronic condition, it's crucial to seek a second or even third opinion before accepting a diagnosis. Your health, your peace of mind, and your future could depend on it. Share your experiences in the comments and don't forget to subscribe for more important health investigations.